Imagine waking up one morning and finding yourself unable to form a simple sentence. The words are there in your mind, but you struggle to bring them to your lips. Aphasia is a language disorder that affects the way a person understands and expresses language. It is not a loss of intelligence or a sign of dementia, though it can co-occur with these conditions. Aphasia is typically caused by damage to the areas of the brain responsible for language processing. This damage can be the result of a stroke, traumatic brain injury, brain tumor, or neurodegenerative disease. Aphasia is not a one-size-fits-all disorder. It manifests in different ways, depending on the specific area of the brain affected. One common type is Broca's aphasia, also known as non-fluent aphasia. Individuals with Broca's aphasia often speak in short, halting phrases and may struggle to find the right words. For example, they might say book, table, read instead of I want to read the book on the table. Another type is Wernicke's aphasia, characterized by fluent but often nonsensical speech. People with Wernicke's aphasia may string together grammatically correct sentences that lack meaning. Global aphasia is the most severe form, affecting both language comprehension and production. Individuals with global aphasia may have limited ability to speak or understand language and may rely heavily on nonverbal communication. Aphasia is often mistaken for other conditions that affect communication, such as dysarthria, dysphagia, and apraxia. Dysarthria affects the muscles involved in speech production, leading to slurred or slow speech. Unlike aphasia, dysarthria does not impact language comprehension or the ability to form grammatically correct sentences. Dysphagia refers to difficulty swallowing, which can impede communication by making it challenging to articulate sounds. Apraxia of speech affects the planning and coordination of movements required for speech. This can result in difficulty forming sounds and words, even though the individual understands language and knows what they want to say. Differentiating aphasia from these conditions is essential for ensuring accurate diagnosis and appropriate treatment. A comprehensive evaluation by a speech-language pathologist is crucial for accurately identifying the underlying disorder and developing a targeted intervention plan. Aphasia can manifest in various ways, and its symptoms can vary significantly from person to person. One of the most noticeable symptoms is difficulty speaking. Individuals with aphasia may struggle to find the right words, speak in short phrases, or use incorrect grammar. They may also substitute incorrect sounds for correct ones, such as saying gable instead of table. Another common symptom is difficulty understanding spoken language. People with aphasia may have trouble following conversations, especially in noisy environments. Reading and writing can also be challenging for individuals with aphasia. They may have difficulty decoding written words, comprehending written text, or expressing themselves in writing. Writing may appear effortful, with misspellings, grammatical errors, or the omission of words. Recognizing the signs of aphasia is crucial for seeking timely medical attention and initiating appropriate interventions. Early diagnosis and treatment can significantly improve outcomes for individuals with aphasia, enhancing their communication skills and overall quality of life. Aphasia is primarily caused by damage to the areas of the brain responsible for language processing. These areas, typically located in the left hemisphere of the brain, play a crucial role in understanding and producing language. One of the most common causes of aphasia is stroke. When a stroke occurs, blood flow to a part of the brain is interrupted, depriving brain cells of oxygen and nutrients. If the stroke affects the language centers of the brain, aphasia can result. Traumatic brain injury, or TBI, is another potential cause of aphasia. A sudden blow or jolt to the head can damage brain tissue, including the areas involved in language processing. Brain tumors can also lead to aphasia, particularly if they grow in or near the language centers of the brain. Neurodegenerative diseases such as Alzheimer's disease and primary progressive aphasia can also cause aphasia as they progressively damage brain cells over time. Understanding the various causes of aphasia is essential for developing effective prevention strategies and tailoring treatment approaches. Diagnosing aphasia typically involves a multidisciplinary approach. A speech-language pathologist or SLP plays a crucial role in the diagnostic process. The SLP will conduct a comprehensive assessment of the individual's language skills, including their ability to speak, understand spoken language, read and write. During the assessment, the SLP may ask the individual to name objects, repeat words and sentences, follow commands, read aloud, and write sentences. The SLP will also observe the individual's communication patterns, such as their fluency of speech, word-finding abilities, and comprehension of spoken and written language. Imaging studies such as CT scans and MRI can help visualize the brain and identify any areas of damage or abnormalities that may be causing aphasia. A neurologist may conduct a neurological examination to assess the individual's overall brain function. Once a diagnosis of aphasia is made, the healthcare team will work with the individual and their family to develop an individualized treatment plan. While there is no one-size-fits-all cure for aphasia, various treatment options and therapies can help individuals regain lost language skills. Speech-language therapy, or SLT, is the cornerstone of aphasia treatment. SLT typically involves structured activities and exercises designed to stimulate language recovery and develop compensatory strategies for communication. Some common techniques used in SLT include word retrieval exercises and sentence formulation activities. Comprehension strategies may be taught by SLPs to help individuals understand spoken and written language. Augmentative and alternative communication, or AAC methods, such as picture boards and speech-generating devices, can provide alternative ways for individuals with aphasia to express themselves. Cognitive rehabilitation therapy, or CRT, focuses on improving cognitive skills, such as attention, memory, and problem-solving. Group therapy provides a supportive environment for individuals with aphasia to practice their communication skills and connect with others facing similar challenges. Support groups for individuals with aphasia and their families offer a platform for sharing information and coping strategies. The specific approach taken will depend on the type and severity of aphasia, the underlying cause, and the individual's specific needs and goals. While not all causes of aphasia are preventable, there are steps individuals can take to reduce their risk. Maintaining good cardiovascular health is crucial, as stroke is a leading cause of aphasia. This includes eating a healthy diet, engaging in regular physical activity, and maintaining a healthy weight. Managing blood pressure and cholesterol levels is also important. Avoiding smoking and limiting alcohol consumption can reduce the risk of stroke. Protecting your brain from injury is essential in preventing aphasia. This includes wearing a helmet when engaging in activities that increase the risk of head injury and taking steps to prevent falls. Early detection and treatment of conditions that can lead to aphasia, such as high blood pressure and diabetes, is crucial. Regular medical checkups and screenings can help identify and manage these conditions before they cause significant damage. Living with aphasia can be challenging, but it's important to remember that you're not alone. Numerous resources and support systems are available to help individuals with aphasia and their families navigate the challenges. These resources can help individuals with aphasia live full and meaningful lives. The field of aphasia care is constantly evolving, with ongoing research and advancements offering hope for more effective treatments. Researchers are exploring novel therapies, such as non-invasive brain stimulation techniques and pharmacological interventions. Technological advancements are playing an increasingly important role in aphasia care. Speech-generating devices are becoming more sophisticated and user-friendly. Assistive technologies such as voice recognition software and text-to-speech applications are empowering individuals with aphasia. By continuing to invest in research, innovation, and support services, we can empower individuals with aphasia to overcome communication barriers and live their lives to the fullest. Subscribe to our channel for more informative content on health and wellness.